Good morning, everyone, and welcome back to NCLEX session. We are now in part 6. A little about myself. I am an advanced practice nurse, and I've been a nurse for way over 20 years. And my main field has been in critical care. But I've also done OC Health and home care and ER, and the list goes on. And I talk more about myself in part 2, 3, and 4 in the very beginning introduction. So I will not bore you with all those details right now. But I also have a master's degree in nurse education. So I am here with you today to enhance your learning, help you to grow, and at the same time, if you are a seasoned nurse, maybe give you some information that you didn't know or you haven't experienced or you can improve upon. So let's keep it real simple. But before we start, go ahead and hit that like button and that subscribe. And I really appreciate your support so I can continue doing what I do here on YouTube. So I thank you so much. So first of all, let's just talk about something real simplistic. Sometimes I see nurses out there doing their own thing. And when I say doing their own thing, I mean giving patients a little something here and there. And they think it's no harm, whether it's a couple extra packets of salt or some extra food from a different tray. You know how we have different trays that come up on the unit, guys? A lot of times we've had a patient that, let's say, was discharged and from the unit. So therefore we may have a couple of extra trays that's not assigned to anyone because that patient, let's say, just went home. But the kitchen didn't get the memo and they've already made a lunch or dinner for a patient that doesn't even exist in the unit anymore. So I've seen nurses, and I'm not going to lie, I have been guilty of this in my beginning of nursing where, you have a patient saying, oh, I'm still so hungry. The portions they gave me were so small. And then you go and say, you know what, we do have an extra tray. Would you like that one? And you give them that extra tray or let them choose whatever they want from that extra tray. But it's really important to really just let the patient, unfortunately, stick with the trays they have. Because a lot of times that food that has been ordered, whether it's a low sodium diet / cardiac diet, a lot of times their body will hold on to fluid that they cannot urinate out, and it will cause other problems. It throws off their electrolyte imbalances and everything. And that's really concerning when you're dealing with kidney patients also, as well as cardiac patients. So I know you really want to do a little extra for your patient every now and then, but let's really stick with doctor's orders. In a hospital setting, many aspects of patient care require a doctor's order for several important reasons. So here I will briefly go over some of the important reasons behind this practice. So these are my top 8 reasons why following doctor's orders are very, very important. And when I say doctors, I'm also including our physician assistants. I'm also including my nurse practitioners. Okay? So, number 1, effective treatment. Number 2, safety. Number 3, recovery. Number 4, prevention. Number 5, monitoring. Number 6, trust and communication. Number 7, legal and ethical considerations. And last, number 8, optimal patient outcomes. Of course, there are many more, but I believe that these are the top 8 reasons why you need to make sure you're always following your doctor's orders. And if you do have an issue with any of the orders, then take it up with the doctor and discuss it. And a lot of times those orders can be changed because they value our input because we're with the patient 24/7. Effective treatments involve the doctor's prescription of treatments, medications, and therapies based on their medical expertise and assessment of the patient's condition. So the nurse following these instructions ensures that the patient receives the most effective treatment for their specific health issue and diagnosis. With safety, the doctors prioritize the patient's safety when prescribing medications or recommending certain treatments, or I should say ordering certain treatments. Deviating from the orders can lead to adverse effects, drug interactions, or other complications that could harm your patient. Speedy recovery. Consistency in implementing the doctor's orders can expedite the patient's recovery process, and this can include post-operative care patients, patients that have certain physical therapy regimens, or strict medication adherence, which all contribute to a quicker return to health, which means they can recover quicker and get out of that hospital. Preventative care. In many cases, doctors' orders are intended to prevent the development of further health issues or complications. So non-compliance with these orders can increase the risk of future problems. So let's say, for example, you have a dialysis patient. A typical dialysis patient may have some strict diagnoses ordered. Maybe they only can have 1.5 to 2 liters of fluid a day. Maybe they only can have 1 gram of sodium diet ordered that day. And let's just use that for an example, because every dialysis patient is different. And they don't all have what I just said, but many do. So, for example, that patient is saying, hey, nurse, I would like a couple extra packets of salt. And because I'm not feeling this hospital food. It tastes horrible and doesn't have any flavor, which is pretty typical with hospital food. Sad to say, but very true. So you feel you're doing your patient a favor. You give them some salt. Next thing you know, they're having problems putting out fluid. Let's say it could have been a dialysis patient that we have some patients they have dialysis, but they also can still urinate a little bit. We call it olguria, which means they are still urinating a little bit. They're not completely anuric. And anuric is without urine, not being able to make any urine at all. So if you have someone that's still making urine, you're giving them sodium. Oh my God. You may have just cut that process off, and now they're completely anuric, and the doctor's like, what's going on? They've gotten worse. Well, oh my, I gave them XYZ of salt, and now the patient has extra dialysis ordered to get off the extra fluid that they're retaining because you gave them all that salt because you want to just make your patient happy, when in fact you are hurting and harming your patient even more. Okay? So again, preventing other complications and issues. Now, with effective monitoring, accurate monitoring of the patient's progress relies on that patient's adherence to whatever is prescribed. So that means you, nurse. You have to really follow the orders, because the patient, they're going to try to ask you to do all different kinds of things. You'd be surprised. Oh my goodness. So any deviation could affect the ability to make informed decisions about that patient's care. When it's the doctor making decisions, or the case manager, or the dietitian, or the pharmacist, or the physical therapist, or any and all the above, which are all the people on the interdisciplinary team, which includes you. Trust and communication. By ensuring our patients adhere to the treatment plan, we are strengthening the trust and fostering effective communication with the doctor and all the other interdisciplinary team members. And it also allows for open dialogue about their care when we're doing rounds. And we can address any concerns and issues that the patient may have in rounds. So rounds is very important. And what I love about some facilities, not all of them do this, I wish they did, but for some facilities, they include patients in rounds. I think that's huge. I mean, the main person that should be included in rounds should be the patient. They should have their input and their spiel on what's going on with their care. And after we talk, we all go into the patient's room and be at the bedside. And after we talk about, what medicines we're giving them, what kind of respiratory therapy treatment we're giving them, and physical therapy treatments, and what kind of diet has been ordered, and on and on and on. We'll ask the patient, hey, so what do you think about what we just said? Do you think we should be doing something different? Is there input on anything involving your care, even down to how you're being treated in this hospital? How is your nurse treating you, and the nursing assistant, and everyone that's involved in your care? How do you feel at this point? What do you want to be different or change? Or are you fine the way everything is? I think that's huge. All right, so next, legal and ethical responsibilities. As healthcare professionals, we have the legal and ethical responsibility to provide the best care possible. Noncompliance with doctor's orders could lead to legal or ethical dilemmas, particularly if it results in the patient getting harmed or neglect. Okay? And I talked about the dialysis patient as an example, so that can tie into this as well. Optimal patient outcomes. So remember, overall, the ultimate goal is to achieve the best possible health outcomes for our patient. And following these doctor's orders, whether it's a nurse practitioner, physician assistant, whatever, following their orders diligently is a pivotal step in realizing these outcomes. And again, remember, it's a group effort. It's all interdisciplinary rounding, and everyone on this team, which includes you as a nurse, and includes you as the doctor, if you're one of the med students listening on. And for people who don't know, a lot of med students, they may be in their first year, second year, third year, but they still have MD behind their name. So when I say doctor, they have already achieved that level where they got the word doctor there. So even though they're still students, because they're still learning and growing, they already have MD on their name tag. Okay? So I am referring to them as doctors because that's what they are, even though technically they're still students too. Which is why a lot of them do come to nurses and ask questions, and a lot of times we have to kind of point them in the right directions, because a lot of us nurses know more than they do, and we kind of just work as a team, okay? And a lot of the seasoned nurses, we guide our med students a lot in the hospital, especially in the ICU, but it's great because to watch them grow and learn as well. We're all a team, guys. So in concluding this video, I threw in some NCLEX style questions that specifically have to do with physician orders, since that's what we're talking about today. Okay, so question 1. A nurse receives a physician's order to administer a medication to a patient. After reviewing the order, the nurse believes the medication dosage is too high for the patient's weight and condition. What is the nurse's best course of action? Is it A, administer the medications as ordered? B, consult with another nurse for a second opinion? C, inform the physician of the concern? Or D, delay the medication administration until the next shift? If you chose C, inform the physician of the concern, you are correct. When a nurse believes that a physician's order may be inappropriate or unsafe, the nurse should communicate their concerns to the physician for clarification or modification, because maybe he just made a little error and he meant one thing but wrote something else. A lot of times, remember, doctors are getting distracted too with phone calls and other people interrupting them as they're writing. And even though that's not an excuse to harm a patient, guess what? Whether you want to believe it or not, but the nurse is the last person that protects that patient from harm. Because, legally speaking, literally legally speaking in court, they will be like, okay, well, you saw an order, you didn't think it was safe, but the doctor wrote it, so you went on and followed the order without questioning it, and something happens to your patient, it's not going to be the doctor that gets in trouble. It's going to be the nurse, even though you didn't write the order, but you administered it, and you have been educated to a level where you should know that, hey, something's not quite right with this order, and you are that last protection for that patient. Question 2. A physician prescribes bed rest for a patient following surgery. The patient, however, insists on getting out of bed to walk around, stating that it's essential for their recovery. What should the nurse do in this situation? A, encourage the patient to stay in bed and follow the doctor's orders. B, allow the patient to walk briefly as it aligns with their wishes. C, document the patient's request but advise against it. D, administer a sedative to keep the patient in bed. If you answered A, encourage the patient to stay in bed and follow the doctor's orders, you are correct. The nurse's primary responsibility is to follow the physician's orders, so encouraging the patient to adhere to bed rest is in the patient's best interest for their recovery. Question number 3. A nurse receives an order for a diagnostic test on a patient, but is unsure of the test's purpose. What should the nurse do? A, proceed with the test as ordered. B, ask a colleague for their opinion. C, contact the patient's family to discuss the test. D, seek clarification from the ordering physician. If you chose D, you are correct. Seek clarification from the ordering physician. If a nurse is uncertain about an order, they should always seek clarification directly from the doctor who ordered it to ensure the test or procedure is appropriate for the patient. Now you might say, why is she saying the doctor who ordered it? And that's because patients in the hospital have more than one doctor. They may have their primary physician there, they may have an infectious disease doctor. They have all different types of doctors that are on the same team, all taking care of them, but they may be taking care of different aspects of their care. You'd be amazed. So you don't want to go to the doctor who happened to be on the patient's chart, but has nothing to do with this order. You want to go to the actual doctor who actually wrote it, not just one of the doctors that's on the team. Okay? Now, if it's after hours, unfortunately, you work night shift, you may be asking whatever team member is covering for that doctor during that shift, because obviously you're not going to wake up the actual doctor who may have wrote it earlier in the day. They usually have coverage while they're home sleeping. They have coverage at the hospital. All right, question 4. A physician prescribes a restricted fluid intake for a patient with a medical condition. The patient requests extra water, stating that they are feeling very thirsty. What should the nurse do? A, allow the patient to drink extra water to alleviate thirst. B, administer a medication to reduce the patient's thirst. C, inform the patient about the physician's order and its importance. Or D, document the patient's requests, but withhold additional fluids. If you chose C, inform the patient about the physician's order and its importance, you are correct. The nurse should communicate the physician's order to the patient and explain to that patient the medical reasoning behind the restriction. It is important to ensure the patient understands the need for adherence to the order. And the last question for you guys is question 5. A nurse receives an order to administer a pain medication to a patient with severe pain. The patient expresses concern about potential side effects. What is the nurse's appropriate action? A, administer the medication as ordered without discussion. B, explain the potential side effects and the importance of pain relief. C, delay medication administration until the patient feels more comfortable. D, ask another nurse to administer the medication. If you answered B, explain the potential side effects and the importance of pain relief, you are correct. Informed consent and patient education is essential. The nurse should explain the medication, what its potential side effects are, and the importance of pain management while addressing the patient's concerns. So if you're still a nursing student, that will explain why your preceptor, shouldn't say preceptor, but because preceptor when you're actually already graduated. But when you're still in school, it's your nursing instructor who's at the hospital with you, and they're grilling you hard. Hey, you're giving Lasix. What's it for? Give me the top 5 side effects. And what's the main thing you want to tell your patient about this medication? What kind of teaching points? And what are the major potential side effects that can be, let's say, life-threatening. Why are they drilling you and drilling you and drilling you? Oh my God. Some of them feel like, oh God, is this the military? Yeah, I've seen nursing students, and I remember being grilled too. But think about it. They're grilling you because you need to know this stuff. You're not going to go run and get the doctor every time a patient has a question about a pill. Because whose job is also to know about medication? We are. Nurses wear multiple hats. We're pharmacy. We're MD. We're assistant. We're everyone. We're dietitian. We're everyone. So you have to know everything. That's why school can be grueling, and a lot of students don't even pass, and they don't get it through as far as you may have gotten through right now before listening to this video. Some students don't even graduate because it's not like it's an easy course. I mean, you have courses upon courses upon courses, and you have to understand it all so that you can get through school and then graduate and then take the NCLEX exam. Okay? Why you need to know so much? Because you are the eyes and ears, you are the protector, and you are the patient advocate. And if you don't understand what the doctor's doing, the dietitian's doing, the pharmacy's doing, or nothing, then you can't possibly be a nurse, because nursing involves all that and then some. It's a rough job. We are very underpaid for what we do, unfortunately, because think about all the skills and all the knowledge you have to have in your head just to be who you are. Okay, so yeah, you need to know all this. So at any given moment, you come in with the patient's meds and they have a concern. You explain the medication, all the side effects. No, but I won't say all, because oh my God, sometimes there's like 2 pages of it. Don't scare the patient to death. But just, general side effects, especially if that's where their concern is, and the importance of why the doctor ordered that particular pain management regimen. So if you have any questions for me, just email me at skillsnacksyt@gmail.com. Again, it's skill, SKILL, snacks, SNACKS, YT for YouTube, at gmail.com. And you see I have that right on the screen. So even if this is something that you want me to discuss that I haven't discussed yet, you want me to shed some light on that, it could be a question about, hey, I'm graduating soon. I want to know what kind of unit should I start on first, and, discuss briefly what your true interests are and what you think you might want to do. Or it could be simply, hey, I'm about to change career paths. I'm in nursing, but I work on this type of unit. I want to know what it's like to work on this other unit. Because again, on my resume, my goodness, in my whole life, I have worked many different units. So believe me, I can tell you some stuff. So yeah, whether it's in the hospital or even outside the hospital, because I've also worked for insurance companies, which is outside the hospital. I've also worked occupational health, which was for an energy company. So I was part of the corporate team. I've worked to home health. So in addition to all the stuff and all the many units and different floors in the hospital, in addition to not just an employee role, but also as a house supervisor, also as a manager, and also as a temporary CNO. So I have done many roles. Okay, so yeah. I am your girl. If you want to ask some questions about your career path and all the different avenues and facets that nurses can take you. I don't know a lot about forensic nursing, but I do have some friends that are involved with that. So even if you need me to get some information for you about that, if that's something you're into, maybe you're into that CSI show and you want to, hey, I want to be a forensic nurse. It's a lot of different things and avenues you can go into with this career in this field. It's amazing, and it's constantly growing every day, including in the IT world. We have informaticists. They're nurses that deal with all the computer programming and things of that nature, keeping the hospital data safe. It's so many facets of nursing, that would take forever to discuss. But yeah, if you have a particular question about either this session or anything in particular that has to do with nursing, I'm your girl, and I'm open and would love to answer your questions. So again, don't forget to like and subscribe, and thank you so much for your support, guys. I will see you soon with NCLEX session part 7. Have a great evening, guys. Take care.